Good morning, viewers. Today's topic for discussion is the veins of heart. So, the main venous drainage of the heart is by coronary sinus, right? So, I have drawn coronary sinus runs in the atrioventricular or coronary sulcus. It's more visible on the diaphragmatic and base surface. This is the coronary sinus. On the sternocostal surface, as I have marked with the fainted lines, this is the coronary sinus. About 60% of the venous blood drain into right atrium by coronary sinus. And the remaining 40% into the different chambers of the heart by two vessels. One is the vena cava minimi and another is the anterior cardiac veins, right? Vena cava minimi or Thibetian veins, right? Now, coronary sinus conveys a greater part of the blood from the left coronary artery, whereas anterior cardiac veins drain most of the blood from the right coronary artery, right? The veins which do not join the coronary sinus are the anterior cardiac vein and the vena cava minimi or Thibetian veins. The anterior cardiac vein, they are 3 to 4 in number and drain the infundibulum of the right ventricle and ends into the right atrium through foramina minimum. Similarly, vena cava minimi, they open into different chambers of the heart through foramina minimum, and the foramina are more numerous in atrial septum. These are more numerous on the right side of the heart than on the left. That's why it might be the reason where the infarcts are more common towards the left side. Right? Now, coronary sinus. Its course, it begins in the left part of the atrioventricular groove. This is the right part of the atrioventricular groove or coronary groove or coronary sulcus. This is the left part of the atrioventricular groove. So it begins in the left part of the atrioventricular groove where it receives the great cardiac veins, right? And then passes downwards and to the right along the posterior part of the atrioventricular groove, accompanied by anastomosis of right and left coronary arteries, right? In the posterior atrioventricular, we already discussed there is an anastomosis between the right and left coronary artery, so accompanied by the anastomosis of right and left coronary artery. Finally, the sinus ends in the sinus venerum of the right atrium in between the openings of the inferior vena cava and right atrioventricular orifice, right? Now I will show you the different tributaries of the coronary sinus. Number one is the great cardiac vein, then middle cardiac vein, then small cardiac vein, posterior vein of left ventricle, oblique vein of the left atrium of the Marshall, and the right marginal vein. Let's discuss one by one. First I will show you people, this is the coronary sinus on the diaphragmatic surface. I draw it dotted. Those I these continuous lines, they lie on the sternocostal surface. These dotted lines, it means they lie on the sternocostal surface. So this coronary sinus on the dotted line, it means on the diaphragmatic surface. So it is visible clearly on the diaphragmatic surface of that coronary sinus. Posterior vein of the left ventricular, oblique vein of the left atrium, small cardiac vein, and middle cardiac vein, right? The veins which are easily visible on this side are the, this is the coronary sinus, on this is on the, actually on the diaphragmatic surface. This is anterior cardiac vein, right marginal vein, small cardiac vein on the this surface on the diaphragmatic surface. This is the great cardiac vein. This is left marginal vein. This is the oblique vein of left atrium. Sorry. Now let's start with the great cardiac vein. Right. The great cardiac vein accompanies first the anterior interventricular artery. Right. Here, this is the interventricular groove. Anterior part of the interventricular, posterior lies the posterior interventricular groove. So it accompanies first anterior interventricular groove and then left coronary artery to enter the left side of the coronary sinus. Similarly, likewise, the middle cardiac vein. This is the middle cardiac vein. It accompanies the posterior interventricular artery as it lies on the, this is dotted line, it lies on the which surface? This surface, diaphragmatic surface. So it accompanies the posterior part of the interventricular artery and joins the middle part of the coronary sinus, as it is already visible here. The small cardiac veins, visible here, small cardiac veins, they accompanies the right coronary artery in the right posterior coronary sulcus and joins the right end of the posterior coronary sulcus, right? The right marginal vein may drain into the small cardiac vein. So it joins the, these are the small cardiac vein. The small cardiac vein, they join the right coronary artery. Towards this side lies the right coronary artery, and osmosis of the right and left coronary artery in the atrioventricular or coronary sulcus. So it accompanies the right coronary artery in the right posterior coronary sulcus and joins the right end of the coronary sinus. Now the posterior vein of the left ventricle. This is the posterior vein of the left ventricle. Runs on the diaphragmatic surface, right, of the left ventricle and ends in the coronary sinus. The oblique vein of the left ventricle, or the, here it is also visible, oblique vein of the left atrium. This one. This is the great cardiac vein. This is the oblique cardiac vein. I have drawn there also, oblique cardiac vein. This one is the oblique cardiac vein. This is the left marginal vein. This is the oblique cardiac vein, right? So the oblique cardiac vein of the left atrium is also called the oblique cardiac vein of the Marshall. Is a small vein running on the posterior surface, as it is drawn dotted on the posterior surface of the left atrium. It terminates in the left end of the coronary artery, right? It terminates in the left end of the coronary sinus, sorry. It dwells from the left common cardinal veins, or, duct of Cuvier. If you people remember, I've told you the duct of Cuvier, also the cardinal veins, right? Left cardinal veins. So this oblique vein of the right atrium. We have discussed the this left duct of Cuvier. They descends downwards into the oblique vein of the left atrium of Mashal. We already discussed in the previous lecture, right? Now the right marginal vein. This the right marginal vein. Oh no, sorry. They accompany the marginal vein of the right coronary artery towards the right side. This is the right marginal vein. Towards the left side, we have the left marginal vein, right? This is the right marginal vein, marginal side of the right, and it may drain into the small cardiac vein or may open directly into the right atrium, right? This is the marginal vein, and they may open into the small cardiac vein or may directly open into the right atrium, right? This is all about the veins of the heart. Thanks you.